Hello and Assalamu alaikum viewers. As you know, TVapex main mission is to bring Pakistanis from home and abroad together. One of the main things we are here for today is part of the same policy, same mission, same goal, as to interview people or to bring people to you who are working for the benefit and the welfare, well-being of the community here and in Pakistan. We have here some lovely guests in our studio today, TVapex studio, from a lovely organization called Azmat Welfare Foundation, which is working towards the healthcare of the needy people in Pakistan. Well, we'll introduce our lovely guests to you today, and we'll speak to them and would know about their goals and missions and what they're doing and aiming to achieve with regards to their mission. We'll welcome Mr. Mohammed Ayub and Mr. Dr. Adnan Ali in our studios.
Thank you very much.
And we welcome to you in TVapex studio today, sir.
Thank you very much. Thank you.
Thank you. And to start with, I'd like you to sort of brief us and enlighten us about how this organization, that Azmat Welfare Foundation, came into being, when, and what was the goal behind its sort of foundation, I'd say.
Well, the foundation was launched in year 2010, although the inception of the idea was as long ago as 2004. Basically, myself and my brother, who is in Pakistan, and I'm here and doing the various things necessary here, and my brother in Pakistan, we came up with the idea that we should do something for the community, for the poor communities, in an area where we belonged, where we were born, in fact, and left that many, many years ago, about 45 years ago, in fact. And we thought that this was a time that we can pay society back, in a way. Alhamdulillah, we are endowed with so many good things, so much goodness, in terms of children, in terms of health, wealth, and many things that we all aspire for. And many of those things are lacking back home in Pakistan, in many areas of Pakistan. This is just simply a one drop in the ocean, but then you got to make a start somewhere. And we felt that we had to make the start. And in 2010, we decided to form this foundation in the United Kingdom. Initially myself and my brother, but then I involved other interested individuals, and mostly the young generation, the next generation of ours. And Adnan, sitting next to me, is an example of that. Adnan is a doctor, a young doctor, and in fact we have 4 doctors already in the group, working towards the goals of this particular organization. And then one of the first things that we are doing, one of the first projects, is building a healthcare facility in a rural area. Again, as I said, where I actually come from, was originated from rather, and I know that there is great need for the poor and needy, and that's why we started. And so we have embarked upon a project there.
Right. So yeah, I think you've addressed the question very well. But it was obviously you felt the medical sector was one particular thing that you wanted to sort of focus towards. I mean, there could have been education sector or something else. What was the interest mainly lying behind the medical facilities provision to the needy?
Well, the answer to that question is obviously there are many problems in Pakistan. Poverty is the underlying all across all communities in Pakistan. So where people may not actually get a meal to live on, like we just take it for granted here. So that is one thing. Education is another, and of course healthcare. And I feel personally, and it runs through our organization, is that obviously clearly people who have very limited means, and if they had 100 rupees, for example, the first thing they would do is spend it to buy some roti and something to eat, so that they don't feel hungry for a while anyway. And so, and the next thing would be health. But because the effect of the problems will be seen a bit later, the hunger pangs of hunger would disappear.
That takes care of the time being.
So that's the priority. So, and we feel that fortunately, in the wider sense, Pakistan isn't particularly worse off in terms of sheer poverty, i.e. like we have many areas in Africa, India and other countries. So there is poverty, people are poor, but starvation, I think, is not as prevalent in Pakistan as in other poorer areas. And therefore, we felt that people put off looking after their health. And there is also the lack of education, but education is a different subject in itself. But so that is the reason that we thought, right, okay, if you give this person some money, that they go and buy some food and eat, and that will be the end of it. They will never look after themselves other than that. They may go and spend the money on something else, and they may actually not spend it wisely or squander it sometimes. But if you or giving them money to spend on health, they might spend it on something else, and then the problem is still there. So we thought, well, we'll go to the bottom of the problem and provide a facility, and those in need will come and actually get that service, rather than feed them with money or literally with food, like a soup kitchen. There are many people doing that. All over, you go to these religious khangas where people get fed. So the starvation, I feel, is not as magnified compared to health problems or lack of health, and that was the reasoning behind.
Sure. So Ayub sir, what has Azmat Welfare Foundation done so far, catering to the missions and the aims and the goals you've just mentioned with regards to the health problems in areas of Pakistan, and what are your future projects and what are you doing currently, basically?
The first thing that we, having formed the foundation, our vision was to provide quality health care to those in need, the poor and needy. Now, then said, well, let's, we all got together, youngsters with me, why shall we do it? We decided that we are going to build a hospital, as a facility in a rural area where there are a catchment of area of about 100,000 people sprinkled over in small and large villages, where the real difference-making facilities are 70, 80 miles or 100 kilometers or so in one direction to Jhelum, for example, another direction is Chakwal, and another direction is Rawalpindi, Islamabad. But the majority of the problem is the majority of the people are not able to get there. They cannot afford to get there. They have no means of getting there, even if they could afford to get there. And when they get there, they they may be waiting there for hours and days to get treated.
Or there may not be enough facilities to cater to their particular sort of problems.
I mean, I have seen an example of somebody where they traveled from I don't know, a couple of hundred miles or 150 miles or so from Gujarat and beyond to Islamabad, and they waited there for, I think, 2 days to get seen for 2 minutes, and then they were given a prescription to go and buy the medicine in the market
from somewhere else again,
and they haven't got the funds. So whilst you can get that eventually somehow, but you don't get. So what we're doing is we're saying, right, here's the need, provided there. that's why and where we're
So how have you channelized that? What you've done basically? Like, what are your projects, or how did you?
The first project of this organization is building of a hospital, which we started 2010. In fact, in May it'll be 2 years when the diggers came in, and alhamdulillah, sterling progress has been made. By 8-9 months, we had the whole building up. We were fortunate. We had funds of our own, which we spent initially, and then we collected funds from generous donors and ourselves and family members initially, but then the wider community, fundraising activities, and like that. So far we've spent an approximate equivalent of about £350,000. A large part, initial part, was our own funds, but the total so far equating to about 4 crore Pak rupees,
Okay.
40 million rupees.
40 million.
And we expect to spend at least approximately 2 million, not 2 million, sorry, 20 million,
20 million.
i.e. 2 more crore rupees to actually complete the building in a state of being able to be used as a facility as well.
Yeah. Okay.
Of course, we'll need further funds for the equipment and the further funds for running of the facility for the years to come. And we are working on ways of building into the organization as to how we're going to finance it, and holding events like we have a recent charity fundraising dinner, which you know about. Last year we did a
I was about to ask you exactly about how do you cater to these sort of fundraising sort of matters. Basically, I've been sort of researching on you as well. You've done. You go to mailers and stuff. You do like you kind of try to be there, and from smaller platforms to the bigger platforms, like from TV channels to small stalls even. So is that
obviously the bigger events take longer to do, more preparation and more hard work basically, and a lot of volunteers. So mashallah, I've got all very committed young people helping me. But like I said, the larger ones have been like the recent charity dinner, which originally we anticipated doing a smaller level, and then it kind of spiraled into a big one. Just like our project started from a little, little facility for a couple of rooms maybe, and what we've got now, it's a 4-story building, approximately 30,000 square feet. And could possibly house 100 beds if it's on a full operational facility, operational state within inpatients. But I mean, that was not envisaged at the beginning, but alhamdulillah, it's there because we worked hard, and it's there, and it'll be there for 1,000 years. We'll be all gone,
inshallah.
But it's something that we have done. We have done for our bit, for society now, and these guys will do for another generation, and then there'll be more generations that'll take after them.
Dr. Ali, my question would be directed towards you. You're a doctor yourself by profession as well, and then this particular foundation, charity, I'd say, as well, Azmat Welfare Foundation, it's linked to, its main thing is health, basically, healthcare provision of to poor and needy in Pakistan. How do you see your sort of link and relativity to this particular project, and how do you fit in as an expert trustee of this this charity itself?
Well, through our initial research, I mean, when we were deciding on what kind of healthcare needs to be provided, the kind of figures we came across, such as 1 in 10 children dying by the age of 5, really hit us hard, and there was simple preventable diseases that these children were dying from: pneumonia, malnutrition, gastroenteritis, lack of vaccinations. And the idea that we came up with, the information that we got, pointed us towards the fact that actually it's the lack of primary care that was the problem. in the UK, I'm a GP, we all take primary care for granted. Whenever we've got a cold or a chest infection or anything like that, we pick up the phone and we ring our GP, we go and see them, and it's quite easy to get an appointment. You're respected for 10 minutes or 15 minutes, wherever the appointment time is. And it was from this research that we found actually this system doesn't exist.
Yeah, that's true.
And that's what we wanted to target. So it's a primary care. Again, that's from experience. The second thing was a birthing centre.
Okay.
Again, there's so many women, unfortunately, who pass away during labour, and that is, the figures are just ridiculous.
Okay, sure.
And again, when we take things for granted here, we thought this is another thing that we need to target. And then thirdly, the other thing we want to do, because this is a rural area, was establish an emergency stabilisation unit. So we recognise that actually the facility we're building, one day will be 100% operational, and we'll have all the facilities for investigating and treating, say, heart attacks and strokes. However, at the moment, the main issue for a lot of people in rural areas is the fact that they have to travel for so long to get their treatment. And it's that travelling time between the onset of the illness and getting to their destination, and a lot of them are perishing. So if we can set up a facility where we can stabilise these people, for instance, somebody who's having a heart attack, we can stabilise that person, arrange the ambulance for that person, and then arrange for their transport to the nearest specialist hospital, then we've really done something there.
You've achieved
and
something, yeah.
not by a massive intervention. We haven't had to invest a lot of money into a cath lab, as they call it, where, with the recent Prince Philip, and having that procedure where they opened up one of the arteries in his heart. Yeah. That's such a simple thing to do, yet for us to put in there would just not make sense. But if we can get somebody from that rural area to that facility, that would be an achievement that would just make a huge difference to those people. So those are our three main areas. And then the other thing that we want to do is actually, and again through experience, is the fact that if I have a patient who's a diabetic, they don't need to be seen every week by a specialist. They may be seen every 2 months or 3 months by a specialist, even 6 months. Yet in Pakistan we're finding that you've got a specialist diabetes hospital opening, a specialist renal hospital opening, a specialist cardiology hospital opening, but nobody's actually trying to bring all these things under one roof.
Okay.
So the other thing we want to do is provide a facility where we've got these outpatient consulting rooms and the ability to invite specialist consultants in one day, every month, every 2 months, 3 months, have a list of these patients who want to or who need to be seen, and for that specialist doctor to come and consult for the day. And we provide the facility, we provide the transport for that doctor to come in, and if there's any cost involved, then the charity can cover that. And again, what you're having is you're saving these poor people from having to take off 2 or 3 days of work, from having to spend thousands of rupees on travelling, and actually allowing them to plan ahead and look after themselves. They know that in 3 months' time they've got a follow-up with this doctor, rather than what happens is that their diabetes is deteriorating and gets to such a point where they cannot continue anymore, and then they're forced to go and see somebody. Those are the 4 areas that we're trying to tackle, and then hopefully in the future, again, this is, as Mr. Ayub has described, once we're fully operational, having a facility where we can have, and this is incorporated into the design of the building, a simple operating theatre whereby visiting teams of, say, ophthalmologists can come and perform cataract surgery. Again, that's not something that needs to be done every single week. That could be once a year. But again, that will make a huge difference without a large cost. And that's where my experience comes in.
Okay.
The other thing we have done is actually we've already sort of trialled this about a year ago in Pakistan. We held a medical camp, and we tried to just have a very mini kind of trial, make sure there weren't too many patients, but also make sure there were enough patients for us to get an idea of what the demands were. And actually it really did prove the point. You know, there's people who are suffering with asthma, they're suffering with digestive problems, skin problems. These people, they don't have time to go to the city to get these things sorted out. Or in fact, they don't have time, they don't have the money to go there. And they can't afford. They're saying that we're going there, we're paying 200, 300, 400 rupees for a consultation, and you come out and then you've got 2,000 rupees to pay for the medication, and you know, you get 2 days worth of medication and you've got to go back again.
They just shun the idea, they won't just live with it. They just
so that's where the medical experience comes in. There's myself, and there's 3 other doctors as well, and we're linking in with other organisations so that we're not repeating what other organisations have done, but actually working with different organisations to bring in the medical experts, the guidelines, the new the different approach we have to medicine in the UK, and try and bring that in to Pakistan as well.
Okay. My question would be with regards to the support of the media. Obviously, you have to pass on your message to reach out there, basically, to people, and then people who can support or people who can benefit as well at the same time as well. What can media in general do for people like yourselves to sort of help and support your causes? And if I talk about TVapex, which is also a community-based TV channel, and will be sort of working towards bringing people together, the community people, and for community from Pakistan, obviously, home and abroad, as I said earlier. How can media help in this and play a part in this scenario?
Well, I mean, we as an organisation, I mean, the trustees we've got are fantastic. We've got accountants, we've got marketing, we've got media, we've got law, medicine, and IT. And so we've actually been using lots of different facilities already. You know, a lot of internet based. We've got a very good website, Flickr, YouTube, Facebook, and it's things like TVapex. We're so impressed that there is this facility there that is actually working for its community as well. And again, it's about the different organisations coming in and working together, and working with TVapex, you know, connecting the Pakistani people in Pakistan with the Pakistani community in the UK and abroad, because it's an international thing. Will not only benefit the little organisations, but actually show that there's cohesion, which is something that's been lacking in a lot of things. There might be us, we're trying to do this project in Gujarhan. There's going to be hundreds of other people doing their projects as well. At the end of the day, we're all striving for the same goal of helping people that are not as fortunate as ourselves. And if we can all come together and actually work towards a common good, which we are, and you know, things like, you know, what you're doing in TVapex, again, you're trying to connect those two groups of people. That's a fantastic thing. I
think we've answered. My next question was about this kind of related to the one I asked earlier. As you can see, there's so many charities and foundations out there here in UK and abroad, and we'll talk about UK obviously. And obviously, you're just one of them, and you're like a drop of, I'd say, of the whole ocean or the river or the sea, you can say. How do you see that situation? Because there's so many other charities and foundations working to improve the lifestyle of the poor and needy within the community. And I mean, I would know the answer, but obviously, how do you differentiate yourselves from them, and then how do you see other people's work as well? Do you want to comment on that a bit?
I think one of the things that we think the reason we're different is because we're taking the approach of grassroots going upwards, rather than taking the approach that, okay, let's pick something really specialised like cardiology, and let's make a cardiology specialist hospital, dump it in the middle of somewhere, and expect people with heart problems to turn up. What we want to do is work from the bottom up. So we want to look after those people with everyday illnesses that we have here. By doing that, we can actually educate these people to look after their own health as well, to improve public health. Again, if we can set up vaccination programs to prevent these preventable diseases, things like gastroenteritis, it's such a simple thing to treat, yet is causing lots of deaths. But if we say, look, okay, we're just going to concentrate on a heart specialist hospital or a cancer care hospital, there's people doing fantastic things, but there's not many people who are actually looking at the causes, the root problems, the ones that are affecting the day-to-day person, because they're not fancy. There's nothing fancy in treating somebody with diarrhea. However, what we can do, a simple intervention makes a huge difference. Another example is malaria. The treatment for malaria is not actually that expensive. Yet, in Pakistan, you need to go to a specialist hospital and you charge goodness knows how many thousands of rupees. But why should it cost so much? And that's again something that we aim to provide. And again, it's a matter of the education regarding malaria. We've got dengue fever causing such a problem. If we can, through our organisation, provide mosquito nets, again, that although it's not strictly speaking treating somebody, but you're preventing somebody. And a lot of the medicine in the UK is based upon prevention
rather than cure itself.
Exactly. Primary prevention, secondary prevention, tertiary prevention. These are all things that are drilled into us when we are studying at university. In Pakistan, there's no such thing as prevention. It's wait until the problem has occurred and then treat it. And if we can start changing that thought process. The other thing we want to do is concentrate on taking doctors from the UK, from America, Canada, the Western countries, Australia, to Pakistan, whether they're originally their origins are from Pakistan or not. But actually these doctors can then train the doctors who are there already. They can show the general public that actually, you know, when you're nice to a patient, when you give them 10 minutes, 15 minutes, 20 minutes of your time, you listen to their problems. That's half.
I think half of their problem is gone already.
Are solved.
Exactly.
And that's something we experienced. I had when we were doing this medical camp about a year ago. I think we had roughly 60 to 70 patients, which is actually quite a large number. It doesn't sound large, but when you're seeing in the UK, when you're seeing 14 patients in the morning, 12 in the afternoon, that's your whole day. That is a lot of patients. And especially myself, I started off with my usual consultation technique that we use here, and it was brilliant. However, it took too long. So it's not the most appropriate way of doing things, but the patients did appreciate the fact that they were listened to.
Sure. I'd like to sort of inform you as well and share with you that TVapex's mission is also, we kind of share the same philosophy, because one of our sort of branches is the provision of medical IT to people in Pakistan, students in Pakistan. What we aim to do is to sort of deliver and transfer a very valuable sort of medical information and teaching through our sort of virtual studios here in England and abroad. So inshallah we're working on that as well, so we share the kind of same vision as well. I'd like to know from both of you very briefly what kind of help and support do you seek from people out there, because I learned from yourselves before that you do require volunteers as well. Do you really need volunteers from medical side as well, or people from other side walks of life or other professions can also somehow collaborate and support you in a certain way?
I think we've been talking only in the form of medical
side
for the moment. But I mean, I think having a facility in the middle of nowhere, it will create employment as well.
Yes.
On a local level, so the cleaners, the admin staff, the the security staff, and the normal non-medical staff here, and we'll need nurses, which are obviously medical, doctors, and so on, and matrons or senior nurses.
Yeah, or people who are living here or from UK and can help your setup from here, maybe, obviously.
Yeah, I mean, as Adnan was saying earlier, one of the ideas is that once we've completed this first project, so that it's in a position where you can start operating from a room like this, and we just put the equipment, furniture, and start operating, is to, having done that, then you employ people, medical staff. Obviously it will cost money, so we'll start off at a lower level, say 1 doctor, 2 doctors, 4 nurses, 8 nurses, whatever, and then appropriate staff. Then there'll be locally employed staff initially, and then will increase as time and money allows. But in the meantime, other non-medical staff will be local. So again, that's sort of local employment being created there. But in addition to that, in order to, what Adnan was saying, is to educate the people and also the doctors as well, isn't it? So we have, say if you were, Adnan is a doctor, if you were a doctor, you are nice and comfortable here, you've got either an NHS job or a very nice private practice, earning several £100,000 a year, nice fat sums.
Not quite, but anyway.
Okay. Anyway, and you feel, okay, you're obviously practicing your preferred loved profession, hopefully, and you're very comfortable, thank you very much.
At the end of the day, yes.
But then you say, okay, and I give you an opportunity and say, look, you are so comfortable, give us some of your money, but in addition to that, or in replacement,
maybe expertise as well,
give some of your expertise. We will provide all the facilities. We've got the hospital facility up and running. The further plans are that we will have an accommodation block to a fairly high spec, so that when you go from here, you'll be like you're living in a very comfortable place. So you get picked up from the airport to the facility.
Your house there.
Yeah. It's like a hotel almost, because if you catered for, you are
looked after, yeah.
And if you're going out for 10 days or 2 weeks or something.
That's a very good idea to motivate people from. Obviously, you get to sort of.
You've got 6-8 weeks from your employment, and if you think you can afford, you want to give, you want to do
your
what
contribution,
you do, your contribution in that form. Which is if you're a highly qualified doctor, very, very valuable, of course, for what we're going to do. I mean, to us it's free, because you want to give it free. But we make it possible, so much possible and so comfortable that you want to do it. And then multiply that by 100, 200. So one of the things in our website is an invitation for people like that. And if this word goes out to many people listening to this program, whether it's on TV or whether it's on the internet, is to say, yeah, I think it's a good idea. I'll go on their website, I'll check it out, I'll put my name in there, and Adnan will phone him, and we'll take it on from there. And just simply register your interest and say, hi, I'm so and so, blah blah blah. Fine. And then we'll build that bank up from 1, 2, 3, 4, 10, 150, whatever. And I mean, just as I was saying, if we had 52 of those people, and we can have one British doctor, or it doesn't have to be British, but any foreign doctor, in the project, in that hospital, every day of the week, free, because that person wants to do it. And if we had 100 people, or 104 people, they could do it 2 weeks, and then and so on. So that's an idea which I think, if we work on it properly, provide, all the facilities, would be a lovely experience I believe, for the person who wants to do it, male or female. It'll, everything will be provided. That's the plan, the dream, so that you feel at home. One of the trustees, young doctors, in fact, she went to Pakistan to do her, what do they call it?
Elective.
The elective.
Okay.
She did 6 weeks or 8 weeks, whatever they do, in Pakistan. And she is so active in this you know, in the organization, because she feels what we're doing is so appropriate and so much needed.
That she decided to sort of join you and volunteer on sort of active
yeah, and
basis.
she's very active. I mean, Adnan's very active, of course, as well. But
I'm sure
I'm just saying that Adnan didn't do his elective there. I mean, she did. This is an example. And she's, I mean, they all call me uncle. But uncle, it's fantastic.
So basically, there are people out there within the field, within the medical side and outside medical field that can obviously volunteer and can help, obviously.
I think people outside of the medical field would be things like IT specialists, marketing specialists,
very well said.
web design. Once we've actually got the organisation up and running, we're going to need a board of directors. We're going to need people who have got experience in logistics, experience in purchasing, experience in sort of medical equipment maintenance, laboratory staff. It's going to be a huge thing, and that over the next 2 to 3 years we are going to start to need these people. Immediately we do need people with experience in marketing and IT to help, especially, I mean, the other thing we're going to need to do is to actually start off with some kind of computerized patient management system.
I see.
If we do that now rather than thinking about that in 5 years' time, it will be far more beneficial. So we need people who have got expertise in those kind of things to come forward. It doesn't have to be an amazingly complex computer system, but something that's straightforward and will help us do the job. If people can donate computer equipment, that's fantastic as well. So it's again not just the medical thing. This is going to be a huge thing, and this is just the first project. After this, what we intend to do is then form branches. This will be our main organisation with satellites.
Sure.
Whether they're, depending on the size of the area, if it's a population of, say, a 500 population village, we can build a 1 or 2 room centre there. If it's a population of 10,000, then obviously you need something bigger.
More,
but that will be the next phase.
Sure.
This will be the hub, and then inshallah we'll have the satellites as well.
More sort of expansion.
So this is going to be, this is going to be an organisation that is not going to be a stagnant organisation. It's a proactive, dynamic organisation that's going to expand considerably in the next 5 years, 10 years, 20 years, 50 years. So those people are definitely needed. They have to come on board.
Sure.
Obviously everybody's volunteering at the moment, and if we can keep it like that, that would be the best way forward.
Sure. Okay, towards the end, I would like you to sort of briefly, if you have to say any or give any message to TVapex's audience in particular, what would it be, as just like other people around as well?
Well, if you are listening, then I would ask you to keep an eye on our website. Obviously, you watch this program, you've heard a few words that we have said and seen a few things that we've done in the recent past. We all give in charity to people in need, whether they be in the UK, which would be less so, or different needs, different problems, or whether it's in Pakistan, India, Africa, or whatever. We are just doing one very small thing, one particular part of the globe, and we invite you to help put some of that money towards us, to help us to help do what we want to do, what we set out to do.
That's cool. Well, gentlemen, thank you so much for joining us tonight at TVapex Studio. And viewers, we'll just take you to this lovely event that took place in London, and actually suburbs in Slough, by Azmat Welfare Foundation, and we'll show you some highlights from the lovely evening. And as you can see, the honourable guests have mentioned that as well, that any type of help would be beneficial, whether it's within the medical side or outside sort of medicine and medical area as well. So on TVapex also believes in the same sort of values, and something that can sort of contribute to community within Pakistan and abroad, inshallah. So would expect you to sort of join hands with similar charitable organizations like Azmat Welfare Foundation, and would like you to support them in future, inshallah, as well. With this, I'll take a leave, and we'll see you, inshallah, on next program. Thank you very much, sir. Thank you.
Jazakallah.
Thank you.
Thank
Thank
you.
you.